There is no weight limit for a weight loss surgery. However, there is a minimum weight loss surgery that is consensus or have been collected data from the American Society of Bariatric Surgeons that the minimum amount is having a 29 BMI. There is a drug for weight loss and is actually pretty popular right now. It's called a semaglutide, but it was not intended for weight loss. It's usually used to treat type 2 diabetes. You might have heard of it. A lot of people have seen Ozempic, Mounjaro, Wegovy, and Tribesis, but those are drugs that will only work when you're taking it, and once you finish or stop taking it, you'll gain all your weight back. Depending on which surgery you have, but the average is about 70 to 80% of excess weight loss. Yes, you can get a gastric sleeve at 200 pounds, the minimum BMI. As long as you meet the minimum BMI of 29 or 30, you'll be a great candidate for the surgery. You should lose a minimum of 60 to 70 pounds within 6 to 9 months. So according to age and what people like to talk about age, there really is no limitation on age. However, we like to have a cutoff between 70 to 80 years old. And if you are a candidate for the surgery, then you should be fine. But we would like to limit in our practice someone that is above 70 years old to have weight loss surgery. So due to the NIH consensus, it states that when you try to lose weight or diet on your own, it's called yo-yo dieting. Yes, you'll lose weight, then you'll gain weight, then you'll lose weight, and you'll gain weight. And the consensus was met by the National Institute of Health that surgery is the only cure for obesity. So the most common surgeries that we are performing in the United States is the gastric bypass or Roux-en-Y, sleeve gastrectomy, or some people would know as vertical sleeve gastrectomy. 3 was lap band surgery, and 4th is revisional surgery. The safest surgery in the United States right now is the vertical sleeve gastrectomy or sleeve. The question is, will your doctor recommend weight loss surgery? I think that the doctor should recommend weight loss surgery because it has shown that if you have hypertension, diabetes, or sleep apnea, you have a 70 to 80% chance that all those comorbidities will resolve on their own. Yes, you can surgically remove belly fat from men and women. It's usually called liposuction. However, by having the sleeve gastrectomy, you will have a natural liposuction and you will see the visceral fat and other fats just melt away due to your weight loss. So there are some questions about who is a candidate and who isn't a candidate for weight loss surgery. Obviously, if you have some severe anticoagulation problems or blood problems or terminal cancer and terminal illnesses, obviously you're not a great candidate for the surgery. However, if we can, we will get the specific consultations with the specific doctors to make sure you are a candidate for the surgery. So after doing 5,000 surgeries and been doing being a bariatric surgeon after 18 years, patients who have been operated on a Wednesday, usually 80% of my patients go back to work on a Monday or Tuesday. There is a chance that you might need extra time, and it's individualized. Some people need 7 to 10 days as a max amount of time, and the minimum amount of time is about 5 days. So the most painful part of the surgery is where we make the incisions. Sometimes patients in the past have described having the pain equivalent or less than having a C-section for women. So, what can you or you can't do after a gastric sleeve? There is no limitation on what you can and can't do after a sleeve. Obviously, the first week of surgery, I'm not expecting you to go and do a marathon. However, I want you to become more active. I want you to have a social lifestyle and start going to the gym and changing your lifestyle so that you will have a healthier and more pragmatic lifestyle than you did before. What's the most painful part of having gastric sleeve surgery is that some of the trocar sites will be in pain. However, I give you a prescription of narcotics or pain pills that should take care of the pain. And if you are not happy or you're not ready to go home, you have the option of staying inside the hospital for one night because it's included in the program. So the scarring, I usually do a plastic closure for all my patients, meaning that all the sutures or will dissolve underneath the skin so that we won't need to cut anything or remove anything after. So it's like a plastic closure. So laparoscopic surgery is very similar to robotic surgery. However, when you speak about robotics, we're using a machine called the Da Vinci, where we dock the machine to the laparoscopic trocar sites. And why is the robot so much better? Because it gives us better vision, 3D vision, and we're able to cut and be more precise with the robot than we would with the laparoscopic procedure. So your expectancy, or what to expect after having weight loss surgery, as I stated on the recovery part, it's usually about 5 days minimum and usually 7 to 10 days maximum. However, since we do it laparoscopically, it depends on the individual. Some people might be very, very stoic and they're like, oh, I didn't feel anything. And some people might be very sensitive. So it really is individually dependent on what type of patient you're going to be. No, so as I said, when we make the incisions, we use these instruments, or something called trocars, and the trocars go in between the muscles and the fascia, so to cause less pain and less harm. So we try not to cut any muscles or fascia if we can, because that is why most patients have pain post-operatively. So how can you expedite your recovery? Is after surgery, the best thing that you can do, it's counterintuitive, is that you should be walking in the halls and post-operatively in the rooms or at home. The more you walk, the more you get the CO2 gas out of your belly. And then in addition to that, the road to recovery is also expedited, which will make you feel better. And that will lead to better outcomes and better results. Yes. So the question is, can you go back to the gym after bariatric surgery? Absolutely. You might not do it within the first week, but maybe the second and third week. I would love for our patients to get into the gym and start walking. As I stated before, exercise will help you get better results and recover faster. Yes. So the question is, can you do sit-ups and crunches after bariatric surgery? Yes, not within the first 2 to 3 weeks. However, in the future, you'll be able to resume all your exercises and that you were doing before the surgery, and that will just take time upon each individual to see where he or she is. There really is no difference in saying which is better or which is worse. I believe that robotic surgery, in my opinion, is a better procedure because it allows me to see in a 3D fashion, whereas laparoscopic does not. In addition to that, robotic surgery allows me to get closer when I'm cutting and performing the sleeve gastrectomy, so I believe I get better results for my patients. Laparoscopic surgery and robotic surgery are not the same. Although the only same things or similar things that you might find is that we use trocars to enter into the abdomen. However, we also dock the system called Da Vinci or the robot to the patient, so that allows us to get, as I said, a better visualization, better results, and better results for the whole entire patients and their weight loss. There really is no disadvantage of doing it robotically. In my opinion, I think it's only an advantage. By doing it robotically, you gain so much visualization, you gain so much visualization in order to perform a better procedure or create a better sleeve for the patient. Robotic surgery is, as I stated, is the best tool to help any surgeon to become a better surgeon. Why is that? The access to the abdomen is a lot easier. If you do a bigger patient, you don't feel the stress and the torque from operating laparoscopically, because the robot allows you more access and more sustainability to the stomach area, which allows you better visualization and better results for the patient. Is robotic surgery a better fit for a physician? Yes, because you are not as stressed. You are not overstressed, meaning that you're not using so much physical force to perform the surgery. It is a less tense surgery for the surgeon because he's sitting at a console, whereas doing laparoscopic surgery, you're standing near the patient, and if you have a high BMI patient, it will drain the strength out of a doctor. So robotic surgery only helps patients irregardless of their BMI, and also helps the surgeon with less fatigue. Now in this day and age, I'm a little bit older than the younger surgeons that are coming out. Robotic surgery is more accessible than it was when I was going through surgical residency. I had to train myself post training, but robotic surgery is accessible to all new residents who are coming out of training at this point. Well, laparoscopic is the entry point of becoming a robotic surgeon. So otherwise, there are some surgeons who still will refuse to become robotically trained because they just feel so much comfortable in doing it laparoscopically. However, being post-trained and post-surgical robotics person, I only think that robotics is the future of general surgery and bariatrics. So bariatric surgery is considered general surgery. However, it is a year post-op training for having a minimally invasive fellowship in weight loss surgery to know those and learn those procedures that are necessary to have good weight loss procedures and techniques. Minimally invasive surgery is doing a post-year or after your training, and what it does is that you don't need to open or go to the old way of general surgery and making a midline incision. So by learning minimally invasive surgery, you're using 3 or 4 trocars and making smaller incisions to access the abdomen so that the person or the patient can recover and have better results faster and leave the hospital faster. There is no weight cutoff for a bariatric surgery, although there is a minimum, and the minimum by the guidelines of the American Society of Bariatric Surgeons is a BMI of 29 to 30. It's a very rare thing, but people can gain weight back after having bariatric surgery because they overeat and they stretch the pouch out or they stretch the sleeve out, and therefore those are considered revisional candidates for the future. No, it's not. Actually, due to whatever procedure you have, that is the point of having weight loss surgery, is for you to lose those 70 or 80 pounds so that your core morbidities will be gone or will disappear. No, actually, that is a very good question. A lot of women ask me that, and men ask me if they can get too skinny. No, actually, the question they usually ask me is if they can lose more. So no, I've never seen a patient say that they are too skinny. They always ask if how much more weight can they lose after having the procedure. So with my patients, after I operate on them, they usually lose a minimum of 10 to 15 pounds per month. So after 3 months, you're looking at 30 pounds to 45 pounds on the average. How would you say they're so happy that they're losing weight that they actually go and they change their lifestyle and become more active, and they don't want to go back to their sedentary lifestyle as they were before. It depends. I've had patients that have had no issues for more than 10 to 15 years, and some people have issues 3 to 4 years. You know, there is no, I wish medicine was like 1 + 1 = 2, but there is no correct answer in my opinion. Yes, your stomach can stretch out after gastric bypass if you overeat and you stretch the pouch out. That is a possibility. So the gastric pouch can stretch if you overeat. It's like having a balloon. If you stretch the balloon out for a while, it will become more distended, and therefore you might lose the ability or feeling fullness or getting satiety in a short amount of time when it first came out. But then if you stretch it out, then you will become more hungry, and then obviously you would eat more because you need to eat more, and the capacity will get bigger and bigger. So in order to be healthy, one should eat a caloric intake between 1,200 to 1,500 calories per day. In addition to that, overeating to where you feel full, and it will stretch your stomach out. As a result, that will lead for you to become eating more and more and more. However, if you are able to have a balanced diet, you should be able to lose weight and not stretch your normal stomach out. The question is, can you get bariatric surgery after pregnancy? I like to wait at least 6 to 8 months after a woman is pregnant before I would recommend having bariatric surgery, because there are still hormones that are running in her body, and studies have shown to wait at least 6 to 8 months after before you even think about having weight loss surgery.